Welcome back to Stop Feeling Like Shit podcast. I'm your host, Daniela Korth, with my favorite person, Dr. Buzz. And on today's episode, we're talking about non-surgical spinal decompression. And welcome back, Dr. Mack.
Thank you for having me back.
So Dr. Mack, if they're just now tuning in, just a little brief introduction about yourself.
Yeah, so once again, my name is Dr. Eric Mack. I'm the clinic director and head chiropractor at Buckeye Physical Medicine and Rehab. Been practicing for over 8 years now. Graduate of Ohio University. Love what I do.
Great. All right, well, let's jump into it. So let's talk about decompression. What is decompression?
So non-surgical spinal decompression is a alternative route of taking pressure off the disc. So pretty much if you have somebody that has a bulging herniated disc, protruding disc, or something of that nature, which is pretty much when you have your vertebrae are starting to close space, and that disc material that is in between the disc is starting to poke out the side or the back and may start to compress a nerve or the spinal cord, we want to take pressure off of that. So what we do is we pretty much attach you to a table that takes gravity away. So we lay you on your back and pretty much allow that table to open up that disc space while pretty much creating like a vacuum effect and letting that disc material kind of suck back into its proper place.
Yeah, I've had that done a few times, and it feels good, actually.
Awesome.
Especially
for disc injuries, it's really the only solution other than surgery for a disc type injury. And I think there's a lot of slangs for disc injuries. People will say they have a herniated disc, protruded disc, bulging disc, but they're all kind of the same thing.
Yep.
So
blown out disc.
Yeah, blown disc, whatever. And what people have to realize is the disc is the cushion. It's the motion segment of the spine. Yep. Your spine is a bunch of hard bones and the soft discs between it that allow your spine to move. And I think the best analogy is almost like it's like a car tire, maybe. But what happens, it'd be kind of like if a car tear, like the tube pokes out of it, it can tear, and then the tube pokes out, and it puts pressure on the nerves.
Yep.
And a lot of times people with disc injuries don't even have back pain.
Yep.
They'll have what they call radicular pain. So what it'll be like, I have a good friend who's a doctor. And she called me a few weeks ago and she said, "Hey, I think I pulled a muscle in my butt working out. But it's been going on for a while now. And we both know pulled muscles heal in a week or two. And I think she had it for 3 or 4 weeks. And I said, "Well, let me ask you a question. When's this pulled muscle in your butt hurt?" And she said, "Well, when I wake up in the morning, it bothers me, and when I'm sitting." So we also know if it's a pulled muscle in your shoulder or your butt or your leg, it's going to hurt worse with activity and feel better when you wake up in the morning.
Exactly.
So if you're listening to this and you have shoulder pain that's worse when you wake up in the morning, or leg pain or butt pain that's worse when you wake up, probably not a pulled muscle. It's going to be a pinched nerve or a pinched nerve in your back.
Yep.
And really we know for sure, we do MRIs as the only way to confirm it.
Yep.
But I can tell you right now, if you have pain that radiates or pain that goes down past your elbow into your fingers, tingling numbness, or below your knee, it's a disc for sure.
Automatically.
Yeah, and what you have to understand with these disc injuries is disc injuries, if they go untreated, always end up surgical.
Yes.
So if you're listening and you have tingling in your fingers or any pain down your arm past the elbow or below the knee, that's a very serious condition that left untreated. Because what happens, that disc blows out. It's kind of like a tire, like it's bulging, but if it blows, you have to have surgery.
You have to have surgery then. Yep.
So you definitely don't want to sleep on these things. And unfortunately, what happens a lot of times is people don't know.
Right.
Because they'll say, "Well, what if I had a disc injury? Would my back hurt?" No, most of the time your back won't hurt with these type of injuries.
It displays itself in other ways. I always tell people when they come in and after we've done our workup, and once again, we're big on our workup, right? So somebody's coming and saying, "Hey, doc, I got this shooting pain that's traveling down my butt and into the back of my leg all the way down to my ankle or my foot." And we do our workup where we do our orthopedic testing where a couple of tests will probably show up positive, such as the minor sign or a Kemp's test or something like that. Straight leg razor or something like that will come up positive, which is normally indicative of a disc involvement. Then we'll do our neurological testing. If we find out that there's some sensory loss or what we call dermatomal findings are not within normal limits, then that's normally indicative of a disc injury. So we combine those things and then we say, "Hey, I want to be a little bit more thorough. I'm going to refer you out for an MRI as well." We get an MRI and it shows us that L4, L5 has a 2 millimeter bulge that's compressing the right nerve. You get what I'm saying? So then we understand that our next conversation with that patient is, "Hey, you're at the fork in the road. This is one of my biggest spiel. If you want to correct this issue, it's either going to go this way or this way. This way is non-surgical spinal decompression. This way is surgery. If you go to an orthopedic specialist or a neurosurgeon, they're going to want to cut on you. here, I think we can help that without somebody cutting on you. And typically, our results from decompression is awesome.
Yeah.
We get
Success
very
rates
good
is probably in the 90%.
90 percentile. I mean,
Yeah.
and I'll be completely honest. Most people get some benefit from it, but that's where education comes in at, right? Because I think some doctors may run into where a patient may go through, maybe 15, 20 visits of decompression. They're like, I'm still I still got some issues going on or this, that, and other. But that's where if you're not educating that patient, because I tell people all the time, you're going to be in the office with me for 30 minutes, maybe an hour, right? When they're coming for treatment. But outside of this office, you're gonna be outside of the office for 23 hours. You can't come in the office and do everything you're supposed to do and get your decompression, which is gonna help, but then leave the office and do everything you're not supposed to do and then expect results.
Right.
Right? So the decompression is definitely helping take that pressure off the disc, but if you go back outside and go deadlift 500 pounds, then
Before the disc heals.
disc heals is a problem, right?
Right.
So that's where education is very huge, because the decompression is absolutely important in correcting the issue, but you also need to help the patient understand that, hey, you're in a certain state right now. We probably need to, start re-educating ourselves and start falling back on some of our bad habits.
Yeah.
We had that happen when we were getting our house painted.
Oh yeah.
And the house painter,
He's going up the
he came down,
steps.
he was going up the steps, and he's like, I pulled a muscle in my calf.
Yep.
Yeah, that's what he said.
Yep.
And then we sent him over to see Dr. Mack, and you
Right.
diagnosed him. It was
He had a
bulging disc in
Yeah,
his
so
back.
he actually had a history of a bulging disc in his back. And,
No back pain.
No back pain, though.
Yeah.
He didn't have any back pain. Came in limping. It was really more his calf. I'm doing my workup on him. A little bit of calf tenderness, but not enough for it to be like, oh, that's a strain of the calf, per se, right?
Right.
And once again, it's one of those situations where when he was active, it really wasn't a problem as far as the calf was concerned. So when I started doing some more of my testing, started to find out, like, hey, a lot of this stuff is coming from the back. I'm doing Kemp's test on him. I'm doing straight leg raise, and it's positive. And he's like, oh, man, I didn't know that was that was going to be an issue. I didn't know that this could come from the back. And once I educated him on how the nerve roots work and how everything goes, he gave me the rundown on his past about how he did have a herniated disc in the past and he never really received any treatment for it.
Yeah,
So
never
then,
healed.
now he's coming to us. He's doing decompression now and he's responding very well.
He's
Oh,
doing
yeah.
He's painting
Doing
my house
great.
again, which
Yeah,
is good.
yeah.
That's
So
what
Right.
it's a win. It's a win-win, right?
Well, yeah, originally when he said, "Oh, I pulled my calf muscle," he's like, "I need to take a day off. I need to leave." And I said, "Okay, that's fine." And then he texted me the next day and he said, "It still hurts." And then I thought, well, we need to get you to the office because honestly, I was talking to Buzz about it and he was like, "Yeah, that's not his calf muscle."
They hurt for 3 or 4 days. It's like,
Yeah.
that's not his calf.
And
It's
that's
gotta be
exactly what you
something
said
that-
when you called me and you told me. He was like, I
Yeah.
think it's coming from his back. And once I did the workup on it, it was absolutely coming from his back.
Yeah,
No
it's-
back pain, though.
No back
Remember,
pain.
you don't have to have neck or back pain.
No
Have a
back
disc
pain.
injury, yeah.
He didn't have any back pain at all. So like that's why it's big also too, not to, kind of take over, but like as a doctor, don't always chase the symptom.
right.
Right? That's why us doing our examination and being thorough in our examination, you can't just chase the symptom. And I think unfortunately in Western medicine, a lot of times it's about chasing the symptom. So
Right.
a lot of times, a lot of patients will come in with that expectation of, hey, this hurts right here, do something right here.
Right.
But then when you explain to them, like, I know that hurts right there, but it's actually coming from here, a lot of them look perplexed, like, how? I don't get it. And that's where you have to educate them. And I show them the nerve chart and dermatomes and how everything is connected. And I always say the body is a homeostatic system. So therefore, like, when things are off, it's going to affect other things.
Right.
So, and that's when I explain that to people. That's when they leave the office smarter than they did before they came.
Yeah. I like decompression too. I know I'm lazy and I never really do the things that we have, which that's not good. But, it's just like one of those things like, oh, I'll do it. No, I can't drive there today. No. But really I should because I've done decompression for my headaches. Like I get cluster headaches or
Yes.
migraines.
Yes,
And so it's really big for that. And I know a lot of people have cluster headaches and a lot of
Absolutely.
people have migraines.
absolutely.
So just a little, it doesn't have to just be, a disc, right? It can be,
But the disc can
A
cause
migraine.
those headaches, though.
Right.
Right.
This is true.
You can have those headaches. Like you said, you might not have neck pain,
right.
but you're coming in with chronic headaches, don't know where they're coming from. And
Mm-hmm.
then all of a sudden we do a workup, we realizing like, hey, you got, a bulging disc at C5, C6, C4, C5 or something like that. Hey, let's start doing some decompression because a lot of times headaches, once again, is an alarm system.
Mm-hmm.
That's your nervous system. You're pretty much your brain saying, hey, something's not right.
Right.
Ow. Right?
Yeah.
This hurts. Now you got to figure out why it's doing that. And then once you figure that out, you start to correct it. Normally that headache goes away immediately
Right.
once
Yeah.
you figure it out. So it's an alarm system and it's your body telling you that you need to do something. And a lot of times we ignore it, right?
Right.
We push through. Oh, okay, I'll push it off. I'll be okay. I'm going to pop me an Excedrin. I'm going to pop me a Tylenol or something like that. Mask the pain, get through your day, and then you're constantly in that cycle.
Right.
So it's all about correction.
Yeah. And another one that's I hear a lot is the sciatica.
Yep.
Yeah.
Overused term.
Yeah. Okay. Because you know, a lot of people say my sciatica this, my sciatica, my sciatica. You know, I'll just be like, well, you need to go to Buckeye PMR. I'm like, you just need to go there and they'll fix you.
Absolutely.
Yeah.
Real sciatica is typically a byproduct of a disc issue, though, right?
Okay.
Because you have your L4 nerve root, your L5 nerve root, and your S1 nerve root. So pretty much what those are is the nerve root that comes from your fourth low backbone or issue or foramen or whatever you want to say, the fifth one, and then your first one of your tailbone or your septum, right? So those three combine and form the sciatic nerve. That sciatic nerve then runs kind of through your butt, but it's also a muscle called the piriformis. That piriformis muscle is either going to run through it or under it, right? So what ends up happening is those people that actually have a disc injury at L4, L5 or something of that nature, they may be compressing the nerve root. That's real sciatica, because what's happening is it's putting a kink in that water hose, right?
Right.
So since that water hose has that kink now, because that disc is compressing it, like Dr. Buzz said,
It was that even the weight of a quarter.
The weight of a quarter, 70%.
70%.
So those people that's getting numbness, tingling, weakness, muscle cramps, and stuff like that, and they don't know why, it's because that nerve flow is disrupted. So therefore, doing a decompression at that area will help to take that pressure off. But then you have the other people that may be dealing with what we call piriformis syndrome, right? So that's where that piriformis muscle gets super tight, whether it's through overuse or, you know, sitting down too much. There's a couple of things that can cause it. And then that compresses the sciatic nerve, which could create sciatic symptoms. But that's not typically sciatica. That's actually a piriformis problem, not sciatica. But if somebody's coming in with degenerative disc disease or degenerative joint disease or bulging or herniated disc that can compress L4 or L5 nerve root, then therefore that's real sciatica. But it gets overused. A lot of people come in at us and be like, hey, I have sciatica.
Right.
And I'm like, how do you know that? Well, I'm getting this shooting pain down in the back of my leg. And then, you know, are you having back pain? No, I'm not having back pain, which once again, if it's a disc issue, you don't have to have that. But it's times we'll do our workup and realize it's not a sciatica or a disc issue. It's just that you got some issues going on in the pelvis per se that may be causing your piriformis to overwork. And then we'll treat it from that aspect.
Wow.
Yeah.
That's
but I think it's really important, you know, I want to maybe talk about with these disc injuries, because they're so serious. You know, one thing I know we're good at with the Buckeye, but I have some other providers I've had issues. You got to do MRIs.
Yes. Yes.
Because if you miss, the only way you can diagnose a disc is with an MRI.
Absolutely.
And if you misdiagnose this, it could end up being surgical. 50% of back surgeries are failures. So it's very serious. So, you know, if you come to Buckeye, we're going to send you for an MRI right away. I know a lot of doctors' offices don't like doing that because of all the paperwork.
Yep.
They'll say, why don't we wait 6 weeks? But during that 6 weeks, you could blow a disc out.
I agree.
You know, other things that drive me crazy is a lot of times the insurance company will want you to go do physical therapy for 6 weeks.
6 weeks, yep.
Which physical therapy always makes the disc worse. So that makes no sense whatsoever.
I agree. I mean, that, like you said, it's
or epidural injections.
Epidural injection. That was the next one I was going to go to.
Epidurals are not FDA approved because they're dangerous. And if the disc is already torn and you're injecting a steroid into a torn disc, you're making the disc weaker. Which makes no sense because you're really fast tracking surgery.
Right.
You know, and then once again, the whole sequencing thing, you know, or you go to the doctor and he says you need surgery. Like, discs will heal.
Yes.
The vast majority, you know, the technique was actually that we use. We're double board certified in decompression therapy. Everyone here is. It was developed by Dr. Norman Shealy, who was an orthopedic surgeon's back specialist. And he developed this technique to help people avoid back surgery. So it's a medical procedure. It's not a chiropractic procedure, but the way we do it here is a medical procedure.
Right.
But that's why it's so effective. You know, so, you know, if you have a disc, always do decompression first. And we also work with Dr. Shoddy, he's a neurosurgeon. So if your MRI comes back positive, we're going to get a second opinion right at Buckeye with this neurosurgeon.
Exactly.
Because these are serious cases. You don't want to make a mistake.
No, I mean, like you brought up a point. I think what separates us from a lot of offices too is that ability to be thorough. Like, we're about being thorough. So we don't want to miss anything. So when you come and do that, you know, our workup, and then we also send you out that day or schedule you for MRI, you know, a lot of people may be like, oh, well, when can I get in and start treating? I want to do something now. But we're like, no, we need to get this MRI first so we can make sure we give you the best care. Because if we're missing that information and we just guessing, then I don't think we're not giving you the best care. You know, that can end up causing more problems down the line if we're not being as thorough as we possibly can. So I think that's what separates us, is we're willing to do all of that little extra work, deal with the extra paperwork, to make sure that we get the best data for this individual or this patient so that we can treat this patient properly. And I think that's why we're successful at what we do.
And a
Yeah,
lot
I
of times
agree.
too, we've had people come in here, they'll be going to another chiropractor getting
Yep.
adjusted.
Yep.
If you have a disc injury, sometimes getting adjusted is like
It's
the
making
last
it
thing
worse.
you want to do.
Yeah, it inflames the disc at times.
So and I know chiropractors, we're chiropractors here, but we don't adjust everybody. If you have a disc injury, you're getting decompression. You're not getting adjusted because it's more appropriate treatment.
Yeah, I'm as biased as they come as a chiropractor, and but even with that being said, I understand that it's not always the solution for every single situation.
Right.
So I think that's sometimes with some of us chiropractors, we could be a little bit bullheaded with the adjustment sometimes. But I just think some of the good chiropractors understand. No, sometimes they don't need the adjustment. They need another intervention. So that's where I think decompression can be very beneficial.
Yeah. Okay. That's cool. Yeah. And you got decompression, you have laser, you
Yep.
guys have shockwave, which all of those are very useful with.
We
Whatever
couple a
people
lot of
do.
our decompression therapy is typically coupled with our laser therapy,
Okay.
or we couple it sometimes with our pulse electromagnetic field therapy as well.
Oh, yeah, the
which is,
PEMF.
So those combination of therapies have been awesome. I mean, the patients have been raving about them. They've been responding very well to them, and I think that's the
Yeah.
that's
I
what
You
mean,
really
makes us
almost
awesome.
have to do it together. 'Cause
Yeah.
what has to happen is, you have the disc that's bulging out. So we use the decompression therapy to suck the disc back in.
Yep.
But what people don't realize
Fibers.
is disc tissue as you get older doesn't bleed. So it doesn't heal well because it doesn't bleed. So if you're not using like a class 4 laser or PMF therapy, the disc never heals properly and the disc will come back.
Yep.
So with all of our patients, we use a decompression to suck back in the protrusion, but then we're using either PMF therapy with pulse electronic magnetic frequency therapy or class 4 laser, which is a hot laser,
Yep.
which is very effective to heal that disc material that won't heal on its own, especially as you get older.
Kind of keep that material in.
Yeah.
oh, wow.
So it's that combination therapy that is so effective.
Yep.
And then one other pet peeve I have is people, they'll say, "Can I get one of those inversion tables?"
Yeah.
Which inversion table is not decompression therapy. Inversion table will make a disc worse for sure because you can't regulate the pressure or the level.
Just relying on gravity.
Yeah, so and you really need
Wow.
to do it for at least 20 minutes anyways. You
You
can't
can't do
lay
that flipped
upside down
upside
for 20
down.
minutes on an inversion
Exactly.
table, and you're going to end up having more injuries. And we've had people come in here that do an inversion and get worse.
Get worse. Exactly.
So, if you have a real bad disc, you don't want to get adjusted. You definitely don't want to do physical therapy. You definitely don't want to do an epidural. And you definitely don't want to go to an inversion table. And those, unfortunately,
It
we
seems
see
like
it a lot
all
of
the
people
time.
do this stuff.
Yeah, those 4 things are the things that most people run and do
Yeah.
when they have a disc. Most people aren't running to go do decompression.
Right. Yeah. And I was just talking to somebody. Somebody had asked me a question on Facebook or Instagram. And they were talking about like their back, I think, or maybe it was a knee. I'm not sure. And I was like, oh, okay, so you have pain. I'm talking to them about it. And they're like, yeah. And I was like, okay, what have you done for it? And she's like, oh, I just went and got a cortisone shot. I'm like, oh, that's terrible. I'm like, don't do that. And most people think that those are good, right?
Yeah.
But really, it only makes the pain go away for a day or two. And then guess what? You're
It causes a
causing
lot of
more
collateral
issue.
damage.
Yeah.
A lot of issues on the back end.
Right.
And then like most people don't even know you only can get 3 in a year in a specific area without
Yeah.
it becoming toxic.
Right.
So it's just like that my brain don't register that way.
But people don't even know that.
They don't. Most
People don't
that.
know that. They think cortisone shots are good. They think epidurals are fine.
It's because their doctor told them. So like
Right.
most people operate that way. When my doctor said, and then I'm like, where are your critical thinking skills at, right? Because I even as educational as we are in our office, I'm big on one giving my patients material to read,
Right.
not just going off of my word. And then 2 saying, hey, research it on your own. Like I jumpstart you with some information, but go look into it on your own. And then
Right.
come back. And when you come back, we can have another conversation because I'm big on when we set up our reporter findings or our second day, I want you to come in with questions because it shows me that you really care and that you engage. I also want you to probably bring your significant other or your spouse with you because they're with you while you're going through your problems. So
Right.
therefore, they can provide insight about your issue that maybe you're not willing to open up to. And I see this all the time where I have the husband in and he's talking and he's giving me, the generic answers. And then, I look at the wife and the wife would be having this face like, so you're just not going to tell him about this issue you got going on, or vice versa. The wife would be giving me the generic answers.
Right.
And the husband would be like, so you ain't going to talk about how you can't sleep. And I'm like, oh, why we can't sleep? And then now we get into the spiel on the why. So we're big on that. So I'm big on just education, information, but also not just going off of what the doctor said. And I think a lot of people do that. That's why they go get cortisone because the doctor told them to.
Right. Because, well, people trust their doctors, right?
That's
They-
true.
they're a doctor.
Exactly.
Well, doctors are good. Remember, it's the doctors not the problem. It's the
right, it's
system's
the system.
flawed.
Right.
Average doctor visit is 6 minutes in the United States.
Right.
You can't figure out a disc injury in 6 minutes. You
Not
just
at all.
can't. It's impossible.
Right.
So most disc injuries go untreated properly until they get to the point where they have to be surgical.
Mhm.
So, you know, or they don't even get diagnosed. You know, it's pain in your butt, pain in your shoulder, and the disc
Pain in
blows
the
out.
hip.
Yeah,
Pain in the hip is another one we see a lot, right?
hip
People,
and even knee.
knee. Yep. People are like, oh man, it's a hip problem, and it's be like, you know, you do your orthopedic, like none of the hip orthopedic tests create a positive, but when I start doing some certain things in the back or doing dermatomal findings or anything like that, then we find positives. It's like, hey, it's coming from your back. Some people that don't register to them because
Until you get that MRI, and
until
the
they
MRI
get that
could be
MRI.
like, yeah.
Exactly. Then they see the MRI and you're like, oh, you got bulging disc at L3, L4, and L5. What? But my back hasn't been bothering me. I understand.
Right.
But this is where it's coming from.
That's so good to know. So I'm sure this has been very good. This has been a good one because a lot of people have these issues
Yes.
and they don't have back pain. So now people are going to be thinking like, oh, wow. Yeah.
I would say if you
this
if
hurts,
you
but-
have pain
Mm-hmm.
in your shoulder, leg, butt, anywhere that's worse when you wake up in the morning or worse when you're sitting,
It's probably a disc.
it's not probably not a muscle. It's most likely a disc,
Yeah.
especially if you've had it for more than a few weeks.
Agreed. I agree.
So that's a textbook example. You know, come to Buckeye, get worked up properly, get an MRI if you need it,
Mm-hmm.
because if you miss this thing and don't treat it properly, it will end up surgical.
Yes.
Wow.
I think most people would want to avoid surgery if they could.
I definitely would.
Yeah,
I mean, because the majority of the time you have surgery, I know several people, they're just going to have surgery again.
Yeah.
And it leads to more issues, right?
Exactly.
So a lot of people, you know, like I said, we always want a quick fix. We don't want to suffer anymore. We don't want to hurt anymore. So we're like, what can I do right now,
Mhm.
this moment?
Mm-hmm.
And so a lot of people are just like, screw it. I'm going to go get the surgery.
Exactly.
And then guess what happens? Now you have another problem. And now the pain is worse. And
The
now
sequence is off.
this.
Surgeries always last.
Right. Yeah.
If you have to do
So-
surgery, we do surgery. And if we can't help you, we'll tell you you need surgery. But
Mhm.
surgeries always last.
Agreed.
You hear that? All right. Well, this was a good show.
Thank you. This is
Awesome.
awesome. Like I said, I thank y'all for having me. I
Yeah.
appreciate
Thank you.
this so much.
Great. So you heard it, people. So if you have pain, just come in and see Dr. Mack, Buckeye PMR. If you have any questions, you have pain or you have a question or you have a thought, you can always ask
All
us.
the
We'll
above.
answer all your questions. So Dr. Mack, thank you again for being on our show.
Absolutely.
We
Thank
love
you.
having you. I know we'll see you again.
Absolutely.
Dr.
I would
Buzz,
love
I'm
to
sure
be
I'll be
back.
seeing you on our next
Appreciate
it.
episode.
Thank you,
All right.
sir.
Thank you so much.
Thank you.
Bye.